Welcome back to What Happens in Vegas. I'm your host, Dr. Stephanie Canestraro, and today we have a very special guest, one of my friends, colleagues, someone who I look up to, Dr. Christine Schaffner, and I've learned a ton from her, and I cannot wait to share this episode with you guys. Thanks for being here.
Well, thank you so much, Steph. The feelings are completely mutual. So I'm excited to be on your podcast.
Yeah, I'm inspired by all the things that you do. You're on the cutting edge of everything. We were just talking before about even the stuff that you suggested to me that I probably wouldn't have been on my radar, or probably because I trust you and respect your opinion, like actually incorporated them, and it's made like a big shift to the ending because I was healing, but there was things that just weren't like like fully resolving. So I want to talk about what all those things are, but you're not just my friend. You're like this amazing naturopath. You train other practitioners. You're doing things on the cutting edge for bioregulatory medicine. I was at a course that you were teaching for neural therapy, which I hope we can even talk about a little bit.
Yes.
And even more importantly for our population these days is, you're really getting into how to deal with the people that are really sensitive and they're not being able to get better with, even things that make sense that should help them. So I don't even know where to start with you, but like, where do you want to start?
Yeah, totally. Well, thank you. That means a lot to me. And, I think, we're both in this together, right?
Hmm.
And I'm very much still a practicing doctor, right?
Hmm.
I see, patients 3.5, 4 days a week for 16 years. And even in my
Hmm.
early days, I was doing like almost 80 to 100 hours of patient care with the opportunities I had. And, really our patients teach us. And
Hmm.
I really think that we're observers. And if we really can, you know, listen, observe, and really, I think a lot of our job too is our patients fall through the cracks in conventional medicine, and we're all creating this new paradigm together. But they really are in tune with their bodies. And once they feel validated, seen, and heard, they share so much. And I think part of their lesson in healing is to tune in more. And our practice is really listening to them and observing them. And so everything that I'm going to share today is because of my patients.
Hmm.
I didn't learn this in a textbook. I've
Hmm.
studied a lot. I went to Bastyr. We're always at conferences together. I
Hmm.
respect a lot of our colleagues. They're also inspiring me. And, we're all on, the shoulders of the people who came before us. So,
Hmm.
honoring that. But, I think a good place to start, Steph, is, like our patients are more and more sensitive. And
Hmm.
I want to really like land today that sensitivity is a symptom. It's
Hmm.
not something that we think, okay, histamine intolerance and MCAS are the cure, right?
Hmm.
It is a window in that terrain, especially since COVID and how
Hmm.
our terrain has become so hypervigilant and overwhelmed.
Hmm.
And you and I, also met through our love for bioregulatory medicine. And I always go back to those roots because no matter kind of like what decade we're in and what warfare or what, new toxicant that we're getting inundated with, if we go back to those principles, we really can help people. So,
Hmm.
wherever you want to go with this, but I definitely think that, again, the sensitivity piece is such a missing
Hmm.
piece in modern terrain care.
Yeah, I think even just starting with the bioregulatory pieces, like, the big things that they look for that even maybe when people see functional medicine, which is getting more and more, people are reaching out for different care because they are seeing that the care that's offered in a conventional model isn't really helping them. So,
Yeah.
some of those main bioregulatory kind of investigation, like what things that they're thinking of that even they're not thinking about in the functional realm.
Yeah, absolutely. And I think functional medicine helped you get a lot of conventional doctors over to kind of looking at root causes, but you can get in the weeds, right? And functional medicine and miss the big picture. And so bioregulatory medicine is a really collaborative system that came out of Switzerland, Austria, and Germany. And I think the main principles are this concept of regulation, which with your expertise in the vagus nerve, very well. But really, I love the like philosophy that is aligned with also, our training is that the body is intelligent, right?
Hmm.
When people are sick, it's not because they're broken or something, bad happened. It's because something blocked that innate intelligence that we call regulation.
Mhm.
And I always kind of turn to there's two systems of regulation, the autonomic nervous system, which a lot of people know about through your education. And the autonomic nervous system can get impacted by trauma, toxicants, and infections.
Mhm.
And when we have a high neurotoxin load, or if our vagus nerve is infected, we have a breakdown in communication, and
Mhm.
that leads to a lot of disease and illness. I also include the fascia in a system of regulation because, again, you know this with all of your work too, that the fascia is also a whole body communication network.
Mhm.
And
Mhm.
when there is, scar tissue or injury in the body, that can also be a kind of like a net for toxicants, pathogens, and trauma. And that can create a lot of dissonance in the body and lack of communication. So we look at regulation from the autonomic nervous system and the fascia lens. And then we have this idea of terrain theory. And I love terrain theory. The opposite of that is germ theory.
Mhm.
Louis Pasteur, the father of germ theory, he was said, and I have somebody who confirmed that he said on his deathbed, the terrain is everything. So he went like full circle in his
Mhm.
and we saw germ theory in action, right, during COVID. Like everybody
Yeah.
was so afraid from this one virus, and people in our practice, none of my patients went to the hospital during COVID. And yes, while we treat infections, we're also creating resilience and adaptability
Mhm.
in the human organism. And we could go into like great length of what that means. But I would say for our conversation today, we'll focus on the extracellular matrix because that's really a piece of the puzzle
Mhm.
with terrain theory and with bioregulatory medicine. And Dr. Alfred Pischinger said that health begins and disease, starts in the terrain, which is the extracellular matrix. And,
Mhm.
we talk a lot about cellular medicine, mitochondrial health, epigenetics, SNPs, and that cell is nothing without a healthy environment. And when the lymph becomes stagnant and disease starts to start in that extracellular matrix, that affects the cells. So that's a really big, kind of paradigm shift,
Mhm.
especially with how people talk about medicine today.
Mhm.
And then I guess the last big concept in bioregulatory medicine is this concept of interference fields.
Mhm.
So it's these either focal infections or these
Mhm.
areas that are hidden from the body
Mhm.
that create this energy leak in the
Mhm.
system, and it blocks, the autonomic nervous system and the fascia from communicating. There's a lot more awareness about this now. So there's scar therapy.
Mhm.
Scars can block regulation both in the autonomic nervous system and the fascia. We also have hidden infections that can be an area that like the body no longer responds. In the sinuses and in the tonsils, those are big interference fields. And so they can collect pathogens and that can migrate into, tissues that can stay inflamed. And then the dental piece is huge. I mean, we still
Mhm.
do so much dental work. I mean, again, the
Yeah.
awareness is a lot. We'll get there. We'll get there there, but, this is a land of root canals,
Mhm.
amalgams, and cavitations. And when you think about it, when you have a dead tooth or an infection in the jawbone, that can affect your vagus nerve, that can poison your lymph and your circulatory system. We know a lot about the oral microbiome and how that affects different systems in the body. So we want to get like that area that the body can't clean up on its own and get that toxicity, that infection out so that the body can heal and repair and not you don't plateau with your treatments. And so
Mhm.
that's like bioregulatory medicine 101.
I have a recent example with one of my close family members that has gotten their old root canal out, and it was actually, like, acutely infected, but we're even talking about things where you can't really see the infection until you take out the actual tooth, and in theory, every root canal is a dead tooth, so it is an
Yes.
infection. It
Yes.
always is carrying an infection. But
Yeah.
anyways, they got this one out, and they went from severe anxiety, heart palpitations
Yes.
to, like, completely zen and calm, like,
Yeah.
by getting that one major infection that has, like, access to your brain and,
Yeah.
connection to an organ, and I was giggling because I still have to get mine out, but as a sensitive patient who's now feeling less sensitive and more like myself, it's almost like the fear of, like, stirring stuff up, it, like, holds you back, so
Yes.
I think patients can resonate with that, but I know that I'm feeling stronger, like, I can handle that, but
Yes.
yeah, it's just now a matter of it's finding the right dentist and the right place like that makes sense for me, So that's what we try and help people with, but that's important as well, right?
Yeah, you need a team, and I don't take any of the things I said lightly. Sometimes I work with patients for months before we, even embark on the dental
Mhm.
interventions, and you need a
Mhm.
great biological dentist and you need a great, doctor on your team because once you take out that infection, the body starts draining more. There's
Mhm.
to clear up. And if you don't have the tools in place, you could have temporarily feeling worse before you feel better. And I don't think you have to go through feeling worse before you feel better. I mean, yes, there is, ups and downs in healing. I'm not, blind to
Mhm.
that, but I think we can soften those times and
Mhm.
give people way more resources. We know so much more, but it's a huge piece. And I guess to your point too, Steph, that I really hope in my lifetime that we have a whole different view of mental health and look at
Oh
it
my
from,
gosh.
toxicity, infection, the brain microbiome. I had early patients in my career who taught me like they would feel like not themselves. They'd feel depressed, anxious. They'd have horrible OCD. And then they do a coffee enema and they feel like completely themselves.
Mhm.
There's this like really big, awareness that like that the illness, has a layer that impacts your mental health and it's not
Mhm.
your true essence, right? So you just have to
Mhm.
support yourself with people who know how to unwind that and get you back to feeling who you truly are. Yeah.
That was my whole okay, so we have had the Vegas clinic since like 2014 or something
Yeah.
before it was trending, right?
Yeah.
And when I came up with or it didn't, I came up with it with my marketing guy that
Yeah.
this is what we named the clinic. And it was because he's like, "Well, yeah, like tell me about the clinic." And I'm like, "Oh, and then I help guys with concussions and then,
Yeah.
you have to do a lot of work with their gut when they have long." He goes, "Wait, I don't get it." And I was like, "Oh, well, the vagus nerve connects it."
Yeah.
And then I was explaining the different bugs in the gut and they can give off different toxins or
Yes.
cytokines or whatever and then it takes a free ride up to the brain and can create brain-based inflammation blah blah blah. And so it's not really like when I named my clinic the Vegas clinic, I was thinking about healing the organs that the information is coming
Yes.
back to the brain from the vagus nerve, right? So I just think that's important to point out because everyone's like, oh, but you're not like showing lots of vagal nerve exercise this, like we do show them and they're helpful, but
Yeah.
they're not like you even said it. What if the vagus nerve has an infection actually in
Yes.
it? Like,
Yes.
what if the toxins aren't clearing around the vagus nerve through
Yes.
your lymphatic duct and they're just being bathed in toxicity? You're
Yes.
going to feel anxious, and your vagus nerve is only doing what it's supposed to do, and it's bringing that information up to the brain to
Yeah. Yeah. Absolutely.
communicate with it.
Yeah, I think that that's like an area that I think we could have both, we've had many conversations where people just say, "Oh, it's your nervous system," and
Hmm.
meditate and relax. And I have some of the most connected spiritual patients in my practice. And when you're sick, you do not feel connected, right?
No.
There is like this kind of, kind of like a barrier
Void.
over your crown chakra. Obviously healing is, feeling more connected again, but
Hmm.
it's because of the impacts of again, the infections, the toxicity, and all of that.
Hmm.
Yeah.
And I remember thinking through my journey of like severe Lyme, whatever, reactivated by COVID, because I had textbook neuroborreliosis 10 years ago or 15 years ago, right? And I didn't even know it was Lyme. They told me I had MS. And then I just thought I treated parasites and I thought I got rid of gluten because I thought was having gluten ataxia because it ended up I had
Yeah.
celiac. And all those things were helpful. And I went into full remission. And it wasn't until later that I realized like it was Lyme that was acutely reactivated
Yeah.
with COVID. So we're seeing a lot of that.
Yes.
But what about like at the same time that COVID was an issue and there was a new frequency released,
Yeah.
right? And I know that bioregulatory medicine honors like frequency
Yeah.
as healing. So like what have you seen since obviously,
Yeah.
2020? Like you've been
Yeah.
working with people for years. Like
Yeah.
how much worse is it? How much harder is it to get people
Totally.
well?
And there's like this convergence of, like, okay, a novel, creative virus, 5G, the whole like soup of toxicity everybody is in. I have patients that I often say are allergic to America. They go out of the country and then they
Uh-huh.
are North America, but they'll even go to Mexico. They'll go out of the country. They
Uh-huh.
feel like like so much better, and then they come
Mm.
back and then their mast cells are on, on fire again.
Yeah.
And so, there's again, more vigilance because we have these new kind of offenders. I would say, like in my practice before 2020, I think Lyme was easier to treat. And
Mhm.
then I would say that even people who were like in remission or recovery, whatever people use to describe themselves, they got COVID and then
Mhm.
they were back in my office because their Lyme reactivated. And I think a
Yeah.
lot of long COVID is reactivated Bartonella and co-infections and also
Yeah.
viral infections. So, and then they're more sensitive, right? So it's like this, horrible kind of regression that people have gone through, or people who thought they were kind of, okay, that they didn't identify with a chronic illness and then they got COVID. And then all of a sudden they found themselves in our, offices because their immune system,
Mhm.
basically their innate immune system was suppressed, and all of these infections that they were, keeping handled all of a sudden, started to take hold in their system. And so
Mhm.
I think the big kind of, point of this too is people who maybe had an epigenetic propensity to not break down histamine, or they had
Mhm.
this more like they knew they were more sensitive, used to call it multiple chemical sensitivity, or
Mhm.
even electro hypersensitivity with, EMF. And then all of a sudden they were full blown. They couldn't even take like drops of tinctures, or,
Mhm.
they took like, one capsule of something, they were flared. And so we had to really like unpack this. And so it all really centers around the mast cell, and the mast cells are, our first alarm cell of our immune system, and they're in key regulatory environments. So they're around the vagus nerve, they're around the blood brain barrier, they're around blood vessels and lymphatics, they're in the gut, they're in, the mucosals and in the brain. And so all of a sudden, when we have a high spike protein load, which directly stimulates mast cells, we have chi that is basically another, mast cells are sensitive to electromagnetic frequencies and
Mhm.
vibration. So that's another stimulator of mast cells. We cannot ignore, the mast cells if we actually want to treat root causes and get somebody recovered. And so, what I've just spent like years doing now is like, okay, what works? How
Mhm.
do my patients, respond? And I would say sensitivity is a symptom. It's a, a kind of what's going on underneath in the terrain. It can be modulated and people can improve.
Mhm.
We don't live in utopia either. So there's going to always be exposures if,
Mhm.
we're in, especially the United States. And so even when people recover, there is some, tendency to still stabilize until we make big changes, in
Mhm.
in our country. And so I'm happy to share like what I've learned and what works, and
Mhm.
all of that. But it's like step one. It's like very much became step one in my
Mhm.
protocols,
Mhm.
and to support my patients so that we could do the deeper healing work and they were not in this like vicious
Mhm.
cycle that's very traumatic. I mean, our patients are so courageous to keep trying things, but like, can you
Yeah.
keep trying things and then you keep like having these horrible reactions and,
Mhm.
all of that. Yeah.
I
So,
know, it's terrible. I went through it and then, I thought I was sensitive and then I saw even more sensitive
yes.
people, and but so, I was on to like the histamine mast cell component at the beginning with my own issues, and
Yes.
I have some posts on it, but I was more of a purist,
Yeah.
and I feel like this was another humbling thing, and I think this is where the merging, if we could just honestly like merge two systems or learn from each other, that
Yeah.
we could help people suffer a lot less. Because
Yes.
I mean, and the mast cell stabilizers helped me. So I did like a combination of like binders that binded up histamine every day, 3 times a day. Then
Yeah.
I did the enzymes that break down histamine, and then I did some natural mast cell
Yeah.
stabilizers, things like quercetin, or that help you modulate
Yeah.
the response. And I had to take a lot, and it calmed it down a bit, but I still, when we started getting closer, was still having pretty severe symptoms, but nothing
Yeah.
like I had before. I was functional, but I was flaring, and then we kind of had a conversation, and I still haven't done one of the main things, but one of the things that I did do was such a game changer.
Yeah.
And I'm so nervous with everything. I started with like a tiny sprinkle, and
Yes.
it was something called ketotifen. And since I've done it regularly, you know, it's lifted another little piece that like
Yeah.
you don't even realize is kind of still bothering you. And it was helping with the rashes and some of my reflux that can be from histamine. So,
Yes.
and mast cells. So I'll let you take it now with like, how do you approach the mast cell
Yeah.
first? And what have you seen natural versus, you know, pharmaceutical grade things from compounding pharmacies, et cetera?
Yeah, totally. I would say too, like, I agree with you. Even before COVID, we saw like parasites stimulate mast cells and,
Hmm.
histamine and all of that. But it was way more, I would say, manageable. And it
Hmm.
was more, you could give like a little bit of support, deal with the underlying
Hmm.
cause, and then people got better.
Yeah.
And now we're needing, like, because of the onslaught and the terrain burden, we're needing to use more and more strategies. So usually I use a combination of compounded antihistamine strategies, which we can talk about, natural remedies. And I think peptides have been like a really strong, kind of like ally
Hmm.
for our patients with mast
Hmm.
cells. So, and I love that you're sharing titration strategies.
Hmm.
I am totally comfortable with starting at the microdose and working up to kind of therapeutic tolerance
Hmm.
just to get people like comfortable and stable. So I often use like a combination of mast cell stabilizers. So Ketotifen, which you talked about, it's
Hmm.
an orphan drug. We even used it before COVID a lot. We used it more for like when people have like four foods, they have
Hmm.
a lot of GI inflammation, which we know can affect the brain too,
Hmm.
a lot of like leaky gut, food intolerances. And it just is, it has like general mast cell stabilization and then some H1 activity.
Hmm.
And so it helps with the four histamine receptors in the body: H1, H2, H3, H4. We
Hmm.
really only have solutions for two of them. So the idea is when the mast cells are over degranulating, which they have 200 mediators that release and over, but histamine is what we talk about a lot. And
Hmm.
histamine just sits on those receptors and overstimulates them. So H1 and H2 are big targets that we
Hmm.
try to calm down. And then I use cromolyn a lot.
Hmm.
We'll either use it retail pharmacy or compounded. And the retail pharmacy, it's a liquid. It's gastrochrome. You take it orally 15 minutes before food. Again, it could calm mast cells in the gut as well as general mast cell stabilization systemically. And then at times we'll use H1 blockers. So that could be a Zyrtec or Claritin. And again, this is not forever. I know these have some drying side effects as well, but it can be like game changer for people just to get their load down. And
Hmm.
two, which is Pepsid. If you have a lot of that heartburn that is not related to H. pylori or, combination of things, that can be that histamine just sitting on that H2 receptor secreting stomach acid. And that can be really uncomfortable. Pepsid, you still can absorb nutrients. PPIs will shut off your acid, and there's a lot of B12 deficiencies and so
Hmm.
forth, but you can still absorb, with Pepsid. So we use that actually a lot in COVID, protocols as well. And so I would say those are my top drugs. And I'm sure there are other things I'm not thinking about. And then all microdose GLP-1s. Dr. Tina Moore taught me this. And she, starts people at zero point 0.5 milligrams of something like semaglutide, tirzepatide. Macro doses are 2.5 milligrams and above. And then I even took the zero point 0.5 to zero point zero 0.05 milligrams because of how sensitive my patients are. So usually a microdose is between zero point 0.5 and grams, and we'll titrate over time. But a lot of our immune cells, and especially our mast cells and also our microglia, have GLP receptors. And so it can create a lot of like foundational tolerance. It's
Hmm.
not for everybody, but it definitely can help. Also, when people have insulin imbalances and high hemoglobin A1C, which can be part of like mast cell activation, especially like you're eating well, you're doing all the right things. Even the microdoses can help that. I call it like leaky lymph. People get that like histamine kind of like swelling, like their like tissues feel swollen, like they
Hmm.
have
Hmm.
great edema. That improves as well.
I
Yeah.
had that very badly in my right arm, and I had a lot of and then that's how I tied it into, like, this big lymph drainage point because when I could drain that but, like, you know, I was suffering through multiple symptoms that, like, again, I could have shut down with some more intense, like, mast cell stabilization slash H1, H2, and, like, I only started taking Pepsid because I had a severe burn or oil
Yeah.
of oregano capsule getting stuck on a hiatal hernia.
Oh my God. Yeah.
Right? And hiatal hernias
Horrible.
are so common in people that have mast cell because there's changes in pressure. There's improper lymphatic drainage, like
Yes.
clogging up our cisterna chyli. Then there's pressure that builds and all everywhere. And people are getting valve problems, like not just their esophageal valve. And I've had more like ileocecal valve, all of that. So, and then I noticed I had to start taking Pepcid for that because then they did a biopsy and they totally screwed me because then the acid was coming up and burning the cigarette burn that was already on a burn. And that's created 2 years of hell for me because if that was gone, I'd say I was almost like completely better. But the
Yeah.
ketotifen really helped. But after I started taking the famotidine, which
Yeah.
is the Pepcid, I mean, I didn't even realize my heart palps were better. My this was like so much, right? So,
Yeah, we see that because of, like, the dysautonomia that happens.
mhm,
We have all these other terrain triggers, and then mast cells also are around the vagus nerve, and
mhm,
cells, when they're degranulating a lot, that can also affect, put us in more, like, sympathetic than rather get the parasympathetics engaged, and then we see a lot of heart palps and
mhm,
POTS and all sorts of cardiac
mhm,
stations that are more neurologic, but they feel very cardiac in
mhm,
origin. And so, yeah, we see a lot of that improve with the
mhm.
right strategies.
Yeah, so that was obviously really powerful because then you feel way more stable in your body and you can start to play around with other things. But I still haven't tried the GLP
Yeah,
because okay, here's my question with those. And this is
yeah,
my problem. And I know it acts way different, but this is me in my own head. And I
yeah,
think so I, I know I have some insulin resistance from all of
yeah,
this. Okay.
yeah,
However, my blood sugar is always very low. My
yeah.
HbA1c from 4.6 to 4.8 every
Mm,
time we test it. But then my insulin is wonky. So sometimes
yeah,
it's higher. And if I do the ratio for the HOMAIR,
yeah,
sometimes it's like resistant, sometimes it's really sensitive. So like, but then I'm like, okay, so my body doesn't need more insulin. It needs to respond to insulin better.
yeah,
And then, but then when I research the peptides and I know I'm going very literal because that's all in the higher doses, it's making you make more insulin. And then
yeah,
I'm like, I don't need more insulin. Right. Like, but yeah.
exactly.
So just
Yeah.
like that'll be helpful
Yeah,
for everyone.
totally. And then, there is also sometimes there are phases, kind of like when we used to think of adrenal fatigue when we oversecrete cortisol and then you go
Hmm.
low. So sometimes the pancreas is over secreting insulin as, a stress response, to the pancreas and
Hmm.
everything. And, the pancreas is an endocrine organ, right? We kind of forget about it, but it's very tied to our whole endocrine health and our adrenals and our thyroid and our reproductive hormones. That's a piece. So what I see with my patients can have high, they can have low insulin. They
Hmm.
often have the higher hemoglobin A1C, but they can have low.
Hmm.
I see at the lower doses that we're creating stability more with the mast cells. And
Hmm.
then the mast cells are creating like secondary effects that are affecting, your hormones, which they do. There's a
Hmm.
whole immune endocrine mast cell kind of phenomenon that's happening. We can also get more stability and blood sugar. Not to
Hmm.
say that is the only thing we should do, right? For you, I'm sure you've, tried all the herbs and the chromium and the nutrient and your adrenals as well.
So every time I do chromium, anything that's supposed to lower blood sugar, I'm
Yeah.
dizzy. I can't do inositol. I can't do
Yes.
chromium. I can't
Yes.
do any of the berberine, nothing. Just like
Yeah.
tanks it. So I think that's why I think I'm going to be like shaking like a leaf like I
Yeah.
do.
And,
That's why I'm,
yeah,
mhm,
totally. And like the pancreas is vulnerable also to brain insults that we don't always think about. Like
mhm,
parasites can affect the
mhm,
pancreas. We can also see Lyme or
mhm,
co-infections affect the pancreas. So sometimes there's, stress on the pancreas. And
mhm,
so I would say it's a good point. Every now and then, it's rare. I will
mhm,
have a patient who even at the microdose and there's so many variables, they do feel like it's a little too strong. And so,
mhm, mhm.
and now are you eating enough? Do you think eating enough protein and all that good stuff?
No, I mean, yeah, no, I like that's the thing, I can't.
And especially with all your gut symptoms, like it's probably
Yeah, like you
you're
don't really feel like eating so
eating.
much.
Yeah.
So,
So yeah, I would probably work on getting like your gut calmed down first,
mhm.
getting your protein intake more. I'm like also sensing your adrenals probably need like more support. And then, from that, like, see how far we get, and then, can we get your blood sugar up a little bit?
Mhm.
Then potentially, if you still need it, do.
Yeah. Yeah.
And then there's other peptides too that work. BPC is a great mast cell stabilizer, also helps with a lot of the GERD and gut inflammation.
That was really helpful for me. I handled
Yeah,
that, and
yeah,
I liked that.
yeah,
The copper was crazy. One single click,
yeah,
severe liver pain and so much acid. And then I was like, maybe that was just a chance, but I
yeah,
hadn't had that at all. Did it again? Yeah, just blocked up I don't know if it's trying to mobilize ferritin because my ferritin's so high and like, how it pushes it out. Like, I
yeah,
don't know, but I just couldn't do it. And then I started to get some like swollen feeling, like when my liver gets backed up.
yeah, yeah.
Yeah.
I mean, bioflow is like lymph and bioflow, I think we're talking
Uh-huh.
about all day long in our patient population.
Uh-huh.
So I think for you, your mast cells are like the most unstable in your GI
Uh-huh.
tract at the moment. I think, getting your root canal done at the right time, I'm there for
Yeah.
you. I think that's gonna put a lot of
Yeah.
gonna be a big relief to your system because that's gonna, affect the lymph,
Mhm.
the vagus nerve, that
Yeah,
affects the liver.
so just to share what I'm doing for that in order to
Oh,
help it
yeah.
is, and it's just helped a lot because like, I would, like, swell up more here. I've been doing that gamma oil
Oh,
topically,
yeah.
and then I rinse a lot of silver in my mouth
Yeah.
and kinda hold it down there, but yeah, I know what's in it, I know,
That's
and so
not
I
gonna
found a
like
guy in
mitigate.
Canada.
Yeah, you got yeah, like, and while you're working up to getting, the root canal, taken out, just for people who are listening, you can mitigate kind of the insult on the body with what just
Mhm.
said. You found a guy in Canada?
Yeah, like, so I found a biological that's doing it in Canada the way I want it, the one and done,
Yeah.
like,
Yeah, yeah.
so this is when they take out the root canal
Yep.
and they put the straight in because I don't wanna go for 2 things at all,
Yeah, it's a
I
lot of
just don't need to
stress.
start healing, and then so if I have enough bone,
Yeah.
just so if people are thinking about it, that's what makes the choice of if they can put the implant directly in.
What number tooth I know we've looked at this together, but just so everybody knows, I'm just looking at the dental organ chart. What number tooth is it again?
I don't know why I can never remember
Oh,
okay, so it goes wisdom tooth, then it goes your first molar, and
yes.
it's the molar after that.
So tooth on the right or left? It's
On
on.
the right. And it is associated with the heart and the stomach, which is like
Yeah, it's 230, which is kind of like stomach, pancreas, lung, large intestine kind of
mhm,
area. So, again, it's not always causative, but it's correlated, and I find that that system kind of just gets held back because of the, like, energetic connection with the meridians.
yeah, and the terrible part about this is it was that Lyme can give you tooth pain, and that's why they did the root canal even though nothing was wrong with the tooth. I had this, like, tiny fracture that they could have just, like,
Yeah.
zipped off, and they missed it, and they killed a very healthy tooth, so, you
It's
know
traumatic, it's horrible. People will get, like, receding thumbs with Lyme too, that's a big tip off, like, if you've
uh-huh,
had, like, a lot of gum recession even when you're young,
mhm,
that can
yeah.
yeah, there's so much that
Silver really helps for that. Oh my gosh, my
yeah,
gums, like,
yeah,
because I was having all that acid and then swishing like, it's, like, better than, I think, flossing because
yeah,
like,
yeah,
I don't
I'm
know.
gonna try your silver that you guys sell, the strep
Yeah.
silver, I
They
haven't.
have this sister company in the States, so
Oh,
I'll
yeah.
tell you. I
Yeah, I
can't
love
remember what it's called right now, but it's
I feel like
their
silver works so much, but you have to get the right kind, the right
mhm.
PM, the right, form, so, yeah, I'd love to try that. Yeah.
Oh my gosh, it's just been really helpful for me, so that's why I talk about it a lot, but yeah, my teeth and my gums are so much better. Like, I think about all the trauma that happened, like, they are nice and pink and healthy now,
Yeah.
like, from doing that. So, yeah,
I mean,
but
I would say as you're preparing to get your bone, in good shape, like vitamin D levels are so important. So you want your vitamin D a little bit higher. And then usually in the States, it would be like around 80 and like good amounts of K2 and like boron and bone building materials. Like that's a good prep if anyone's getting dental surgery. Yeah.
mhm. Yeah, so my vitamin D was also always tanked on a lot of people that have these chronic infections,
It's
and
25.
I was really not absorbing vitamin D no matter how I took it until I started doing the Desbio liposomal one.
Cool. That's good to know. Yeah.
And it helped me. It took away, like, my cramps, like, severe cramping, but if I don't get my vitamin D levels high enough during the month, I will still have, like, severe, like, endometriosis type cramping.
Yeah. Oh, that's really tough.
And by that, I mean, that's for people that, if you know what I like, it's not even just in the uterus. It's like my whole insides feel like they're burning. And the thing is like that went away for a long time with the Frankenhausen
Oh, yeah,
Franken
the
yeah.
pelvic plexus injection and neural therapy, and there's a huge connection also with, mast cell and endo, so endo is
Mhm.
complex, and I'm not a expert, but, a lot of my patients end up having endo, and we feel them getting to the right experts and stuff, but there can be, low, like, DAO, and then also, estrogen dominance can stimulate mast cells
Mhm.
as well, so there's like a
Yeah, we can talk
cell
about the
connection.
hormone stuff, but I've seen that firsthand because so I've been tracking my hormones and my estrogen is higher than most 20-year-old. Like it's crazy high. Like
Yes.
my progesterone is keeping up and it's like working hard and they're both like so high.
Yeah. Yeah, and so there's, like, a lot of things, happening, with women
Mhm.
and their hormones. I would say, with estrogen dominance, you could have an epigenetic propensity not to break down, like, so, like, I don't do a
Mhm.
lot of SNP work, but, like, COMT usually is,
Mhm.
like, a SNP that women have, and then, we think about, like, liver congestion, right? Because the
Mhm.
estrogen has to be metabolized, through the liver, and then if you've had a mold exposure and have Zearalenone,
We
that
talked about that.
yeah, that could be like a mycoestrogen.
Mine was so through the
Yes.
roof.
So it just makes like puts fuel on the fire. And
Mhm.
then we can test in certain GI labs beta-glucuronidase, but there's something called the estrobolome, the microbes that digest and help you break down his estrogen rather. And if you have high beta-glucuronidase, then when the estrogen gets to your gut, the microbes basically cleave it and it gets recirculated to the liver. So that's why we give like calcium-d-glucarate, not only for estrogen and to override that, but also it helps to get zearalenone out of the body as
Yeah.
well.
Yeah, so we talked about that, and this might resonate with some people. So, from what happened to me to my esophagus, I still can't swallow stuff. And when I've tried, I can swallow everything else, but a pill will still get stuck. It must
Okay.
still just be a little sticky there. I'm not sure. It's
Yeah.
crazy. I've tried. So I have to open every pill. So when I open the calcium D-glucarate, it's so acidic that I can't
Yeah.
take it. So now we're gonna. You were you. It was your suggestion to make it into a suppository. So
Yes. Yeah.
I'm
Okay.
gonna
Good.
do that because my beta-glucuronidase is like 5,000
Yeah.
and my Zen mycotoxin, which you were talking about, the estrogen mimicking, went through the roof. I had a severe mold exposure when I was in the Dominican,
Yeah.
and I tested my urine, and that was through the roof. And, for women listening, I got my period like immediately after that mold exposure, even though I was on day 14. Full
Yes.
period, like not just like, so and then that happened. It's just starting to normalize. So, it's a lot of information, but our body's always trying to do something and help us out. And then we have our own roadblocks. So I'm doing my best to support those. Glutathione helps, right?
Yeah. Glutathione.
Me for those hormone feelings.
Yeah, and glutathione is again another phase two detoxification agent in the liver, so it can help, shuttle out mycotoxins and help with
Mhm,
estrogen metabolism. And maybe one other point about the what I've learned and observed
mhm,
over the years is that, obviously with menstruating women who have Lyme and co-infections and mold illness and parasites and long COVID, and mast cell, there's like, times of the month that you feel better, right? And so I
mhm,
just paid attention a lot to that. And even before COVID, my patients like textbook would say, I just feel worse that 1 week before my period. And I
mhm,
like never knew what that was, and I kind of figured it out. So, and again, just listening to patients, right, which we
mhm,
both do. So, in the beginning of your cycle, estrogen is rising. So that is kind of biologically when your immune system's more robust because you're not potentially pregnant, but it also can stimulate, estradiol stimulates your mast cells. And then I often, when the shift happens in hormones around ovulation, with estrogen starts to decline, but progesterone starts to rise. So progesterone is a mast cell stabilizer, so it can
mhm,
actually help with the blood-brain barrier, stabilize mast cells, but it's also immunosuppressive because you might be potentially pregnant, right? And you don't want to react to that foreign DNA. And so nature created more of like immune suppression. And then when you're, that last week before your cycle, progesterone starts to decline.
mhm,
So basically, your immune system starts to wake up and your
mhm,
mast cells start to wake up to what was suppressed and asleep. And so people get really flared up around that time, and prostaglandins rise that are
mhm.
in nature inflammatory. And so I've only found one woman, Steph, who studied this. Maybe there's somebody else now, but Mary Lynn Barkley, she's out of UC Davis. It was in like 2000. Like she studied women with Lyme. And she like, I kind of call it, I coined the term luteal phase flare just because like that's
Hmm.
what I saw a lot. And she had words for it. And she even says that if you want to do Lyme testing, I don't
Hmm.
do this enough in practice, but doing it during that week before, your cycle to get a more positive test because
Hmm.
the Lyme is more active. So there's
Yeah.
just this whole like rhythm to our body. And especially if you're a female who's still menstruating, like pay attention, because your
Hmm.
body is always talking to you and then we can support you. So like often our patients have low progesterone, not like you, but usually progesterone is low.
Yeah, usually that's what I
Yeah,
see
the
too.
adrenals are overtaxed. And so we support with progesterone and then doing more of your Lyme treatment in higher amounts
Hmm.
during that week before the cycle. And then
Hmm.
that helps in other things like keeping primrose oil and maybe some more mast cell stabilizers. And then we get people through that.
Hmm.
So,
Yeah, no, that's really helpful. I do a lot more. I do need a lot more. I can tell when things are going on because I need a lot more binders around that
yes.
time. And like,
Yeah.
because then when you take that load off, it's helpful.
Yeah. What's
Mm.
your favorite binder right now?
Well, again, mine is more biased towards my esophagus. So when you
Yeah.
open the capsule, Toxaprevent's the most
Oh, yeah.
gentle. It's a clay-based one. So what is this talk about the not using zeolites, something to do with that Maria Crisp?
Zeolites, so I don't know her, but I know she created a product called Novolytic that I've been using in practice to help digest spike protein. It's a good biofilm breaker.
Hmm.
I've been using it myself. I like it. So zeolites can be very, very helpful, but in nature, zeolite comes as aluminum silicate. So
Hmm.
silica is like the best binder for aluminum, so it's tightly bound. So like the silica binds the aluminum and then it's a sponge for basically mycotoxins, histamine, a lot of organophosphates, biotoxins, aluminum even.
Hmm.
And so what happens if people process the zeolite and cleave the aluminum from the silica and don't test the aluminum levels, you could actually be creating toxins.
Okay. Yeah, no, Toxaprevent is an extract of zeolite and it's an extract of the extract, so the
Yeah,
clinopellet.
yeah. So
So it's actually MANC. They have a proprietary still for it,
yeah,
and they've made it even more specific to histamine and it soothes
great.
the gut lining. So
I'm gonna start using that more.
so it definitely was a game changer for me, and I've done zeolite and it still helped me, but it didn't help me as much as this one. And then that's also what we see in our patient base. We can see it flare people if they're in really active mold, but usually it's the more gentle binder that we use. But yeah, sometimes it's just not good once in a while. Like,
Yeah,
and like one guy in particular who it like hyper flared, they found right in the vent coming at him was the mold. Like,
yeah.
and so once he moved out of there, he handled the toxic prevent once they tried it again. So like, but
Yeah.
yeah,
And that's
but
the thing. Yeah, I was gonna say, like, if you're like tried everything and you're still reacting, you're most likely a mold, and
mhm.
that we could talk about that all day long, but that's a big clue. Some of my most unstable sedated patients are still mold.
Yeah, and even like if we talk about mold in regards to like the novel frequencies, we know
Yeah.
that say you already had like a mycotoxin load because you have something colonized in your body, and now we get 5G coming at us, right?
Mhm. Yes.
And they make more mold spores. So,
Yeah, the mold it's like this pleomorphism idea. Mold gets more virulent, especially in a they studied the gigahertz, what they did. I can't remember quoting the exact study that I shared at Does Bio, but they did, they've done studies of kind of even just your Wi-Fi router, right? So we have 5G, we have your Wi-Fi router. So those normal kind of bands of frequencies in Wi-Fi can basically create even with one exposure, can create long lasting fungal like virulence. And so it makes more mold spores and becomes like a more virulent mold. And so mold, I've only been practicing 16 years, but like mold was always there, but it
mhm.
definitely, I feel like it's a combination of how we make our homes in America. And
Mhm.
I love when people say, "Oh, I'm in a new build. I can't have mold." And I'm
I
like, "Oh
know.
God, those are probably the worst. We don't make homes as we used to. Even
Mm-mm.
the older homes, can be like have better bones at the end of the day.
Mhm.
They don't have all that saran wrap, Tyvek. But anyway, I think just the soup, just think of,
The
and
toxic soup.
yeah, yeah, just the soup and then the electrosmog that we're all in has
I
created a lot
know.
of virulence externally and internally. So
Mhm.
it's just, yeah, it keeps us busy in practice.
It's terrible. Like, it's terrible that, like, they toyed with stuff so much and but also they're not giving the right answers. Like, do you think that they know how toxic these things are and they have the antidote
Yeah,
that of the like,
yeah, I know. It's something that I waffle a lot in. What people have today is beyond nature, right? It's
yeah.
beyond nature. There's a huge man-made element into why people are so sick, and it takes more, like beyond natural like solutions.
Mhm. Mhm.
I'm a purist too. Like I went to naturopathic school, but I've been humbled of what you need to treat and clinical practice. And I use a lot of medications with a lot of terrain principles. And so
Mhm.
because of we have to meet the force of, what we're treating with the force of the intervention. And so I do think without getting like super like conspiracy, I do think there is like a force in the universe that is, keeping people sick, whether it's just purely capitalistic and big pharma
Mhm.
runs our government, or, it's more sinister than that. But we're at this threshold that so many systems are impacting us, right? Big pharma, big food, big tech, all of this. And maybe it's just coincidental or, coordinated. I don't know. But it's just, again, what we're seeing is the microcosm in clinical practice of what is impacting the everyday human.
Even there's people what's been, like, the most, like, eye-opening for me, because I work with what should be considered and I don't think they're the healthiest population because 'cause they're not always they can be skilled. They're athletes, though, but they're outputting a lot of energy, and they have to be able to be hit, so they are resilient, right? And then seeing them start to have the symptoms I was having when they've never had a symptom like that in the
Yeah.
past, and now they are a sensitive person with POTS-like symptoms
Yeah.
and you're like, "Wow." And you're like and then everyone's like, just movement helps lymph, and then you're feeling them and their deep lymph is so stuck that it's
Yeah.
creating, like, pressure on their organs and everything. So, it's crazy. It was really crazy for me. First of all, I was feeling perfectly fine when all of this turned on. It had been a decade. I wasn't getting rashes. I had cramps once a month. That was my symptom I still had, showing there was still a mast cell issue. But I was fine. I was working out 4 times a week. I was still eating healthy, but and I was do it's just like that's to me is like it's happening like that for people,
Yeah.
right? It's like you're hijacked and once it's turned on, it's like working backwards. Like you really have to work backwards. So that's another thing that I think is crazy, right? It's
Yes.
not always just the sensitive person. It's turning fully resilient people into the sensitive person. And I know there's a lot going in the background
Yeah.
subclinically before it's clinical, but it's terrifying a bit.
Yeah, and as I mentioned, I've seen, like, my patients came back to my practice who were better, and then people
Uh-huh.
who never thought they were even identified with chronic illness, that we just kind of blanket
Yeah.
call long haulers or long COVID, uh,
Mhm.
found ourselves in our offices because, they were keeping it all together until they weren't. Yeah,
But okay, again, we're not going into conspiracy. I
yeah.
hate calling them conspiracy theories, but like, is it real or have you looked into it at all? Because I've been seeing people show the side effects to the COVID vaccine is hantavirus.
Um, yeah,
I haven't looked into it, but
I
I saw
haven't
that.
yeah, I know there's a lot of, you know hantavirus is around the US today, and this just comes back. It doesn't have to be like in the news to actually still be like a virus that, we potentially could be exposed to, from
Mhm.
rodents. But it comes back to the immune system and
Mhm.
terrain. And I think what happened with the COVID vaccine, and a lot of people, it's a very complex topic because a lot of people got coerced. They weren't
Mhm.
allowed to make decisions for themselves.
Mhm.
I have a lot of compassion depending on,
Me
where
too.
people were. And I don't think if we weren't in this industry and already knew, like we just saw the red flags coming, right?
Yeah.
We're very cautious. I'm always cautious, with my patient population. They're not going to be the first to do anything
Mhm. Mhm.
because of, their canaries, right? And so, yes, I think what happened is a lot of people's immune system, what's called your innate immune system, and even it's not this cut and dry, but even when we talk about mast cells being overactive, there's like what we call two arms of our immune system, Th2. Again, very loosely, it's way more
Mhm.
complicated than this, but
Mhm.
Th2 is like more mast cells, antibody response, allergy phenomenon, and Th1 is more like your fighting power, your natural killer cells, your T cells. And Cyrex Labs looks at this with immunophenotyping. But so what happened is, we're more sensitive and more inflamed and hypervigilant, and then we have less fighting power. So then people are, that's why we're seeing, more cancers and cardiac vascular illness, more long COVID, more, reactivation of viruses and infections because, the system at the end of the day is suppressed. And
Mhm.
we really have immunodeficiency. It's modern day
Mhm.
immunodeficiencies. And so, yes, we have to lower load. That's a big part of it. But I'm always, my patients will go to extreme lengths to recover themselves. And so I'm even, learning at like what's going on in Mexico in clinics to like help rebuild people's immune systems. And, at the end of the day, it's like the immune system is like
Mhm.
what got so hit, with
Mhm.
the whole COVID story.
And I've seen that with players. So, like, when you look at an athlete's blood work, they generally have lower neutrophils and lower white blood cells
Yes.
because they're very active, and those are the cells that leave our circulation to clean up tissue that's been
Yeah.
injured. And so they also, your amount of cardiac output is like a J-shaped curve for, okay, you increase cardiac output, your immune system gets better. Once you hit a cusp, it tanks and they get more respiratory infections, first getting COVID, the first getting this, but a lot of their immune systems haven't recovered in a way, in it's even
Sure.
showing up in their blood work. You're seeing at 1.6, 2 point this, say it's supposed to
Yeah.
be between 5 and 8.
Yes.
And I always thought this was interesting because mine has not gone down below 10 or 11
Oh, wow. That's yeah. Yeah.
but it's like, but then if you look at when I did a live blood cell, my immune cells are there, but
Yeah.
they're not reaching into the cell and doing anything. So
Yeah.
they're like being produced, but they're like not really functioning.
Yeah.
Right. And you see all the infection around it. And I mean, obviously it's gotten better since I've lowered the load and everything. It's much better. Sorry, now it's like 8 or 9, but it's never like, it's always
Yeah.
8 point something 9.
Yeah.
But when I first went, it was like 16 and then it was 11 for a long time. So it's like,
Yeah.
it's just like what you're talking about, though,
Yeah.
depending if TH1, TH2,
Yeah.
like depletion. But yeah,
Yeah.
I just found that interesting. I've been seeing that a lot, and something that stood out before, and now I see other people talking about like the voltage of the cells, right?
Yeah.
Because again, I was shocking everything. Like I felt, and then they put a wireless heart monitor on me, and I believe that that's why my symptoms went from what would have been manageable and not crazy to when everything got access to all
Yeah.
my organs. Because that's when it went from my heart to my liver to my kidneys and whatever else. And that's what got me looking more into the like electromagnetic
Yes.
type of things, right? And Bluetooth and Wi-Fi and blah blah
Yeah.
blah. But everyone that was having the similar symptoms as me had the elevated calcium. And I was like going down this rabbit hole, and then that's when I found the voltage gated calcium channels, the
Yes.
leakage of the cells and da da da. But like, the stabilization of the cell membrane and or the destabilization that's
Yeah.
happening. What do you think about that?
Yeah, I think that's such a big piece. I kind of learned it on the flip side, but it's the same thing that
Mhm.
I find that my patients need more and more salt and electrolytes.
Yeah. Yeah.
They've been, mast cell activated. And when you
Mhm.
go down into the extracellular matrix, there's many like layers and levels to look at this. But at a fundamental layer, we have charged particles, negative and positively charged particles inside the cell and outside the cell. And there's
Mhm.
a lot of, sodium reserve in the
Mhm.
extracellular matrix to help with something called depolarization, healthy depolarization.
Mhm.
One, you need to have a cell respond. And what happened is, the salt is going lower in the extracellular matrix from either being mold exposed and having low antidiuretic hormone to adrenal issues and having low aldosterone. So that's the dizzy, POTS, low blood
Mhm.
pressure people who are constantly thirsty and they're peeing a lot. And so the calcium goes into the cell more
Mhm.
easily. So
Mhm.
that's happening on one level. And then we have the 5G and the EMF
Yeah.
through Dr.
Mhm.
Marty Paul's work that the calcium threshold is going down lower and
Mhm.
lower because there's more calcium influx
Mhm.
a cell, and then that creates depolarization. And so
Mhm.
you're getting the mast cell destabilization from low
Mhm.
salt and 5G.
Yeah.
And then, we try to like obviously help environmentally, but giving people K2 and trying to get that
Yeah.
calcium back into the bones and out of circulation is important too.
Yeah, that's huge. K2 did help me a lot. Another thing, so I saw calcium channel blockers helping people so much,
Yes.
right? With
Yeah.
these, and I didn't personally take those, but I took motherwort, which
Yeah.
is, you know,
Yeah.
nature's calcium channel
Yeah.
blocker.
So beautiful.
And like things like hawthorn and things like heart tonics and stuff, and those were really helpful. And then once I dug more into like hawthorn and saw, it does stabilize mast cells and it does help the liver a
Yeah.
lot. Like that was like that was one of the things that helped me quite a bit with like the heart palps and all of that
Yeah,
kind of
that's such a
stuff.
good reminder. Yeah, hawthorn is a beautiful herb, and motherwort and lemon balm, all of those can be,
Mhm.
help
Mhm.
with the
Mhm.
cardiac inflammation, the like just the destabilization of the heart
Mhm.
rhythm. Yeah.
So I think like everything like this epidemic of sensitive patients,
Yes.
which, you have your sensitive patient stack, right?
Yes.
That people can join that program with you
Yeah.
because
Mm.
you're helping guide people, right? And how to get to a point where you're healing and not just reacting to anything that's supposed to heal you.
Yeah, no, thank you. There's only so many people I can see, right? I'm just one person.
Mhm.
That's why I'm also passionate about,
Mhm.
training doctors. I know that we love doing that together. And I, just want to help get people to get on the right path, to healing. And this is, I've learned so much through my patients. And I just want to share it to people who might not be able to come see me or working with another provider that they can communicate this with. And so I created this program that we're just launching called the Sensitive Stack. And so
Mhm.
really giving people like the why and then the how through education and really helping them to be their own detective and work with a provider that can really help them unpack this because it's such we do this all day long so we're like oh everybody knows this but it's still
Mhm.
there's still a lot to learn here and I
Mhm.
just want to help more people. Yeah.
Yeah, so you can find that on your website,
Yeah, on
right?
my website.
And on
Dr.
Instagram.
Yeah, Schaffner.com. Yeah. Yeah.
Mhm.
Yes.
Yeah, so definitely check that out if you're a sensitive person and you want to, um, work with Christine too, one-on-one if you're taking new patients
Yeah,
still.
people get better, so I'm always, we always are open to seeing new patients and,
Yeah.
scheduling
Yeah.
out. Yeah, for sure.
And we're gonna figure out some sort of program together at some
Yes.
sort.
Yeah. Yeah.
Yeah.
No, our paths keep weaving and I love it. And we have such
Mhm.
similar passions in the people that we serve. And so
Mhm.
there's, yeah, so many people to help. Like, so we just have to, continue to collaborate and join forces.
Anything else you wanna talk about? I mean, we've already been talking for an hour and I could keep
Yeah, I
going,
know,
but
I know. I'm like, "Oh my gosh, over an hour." I mean, we could have, I'm sure like a part 2, but
yeah.
you know, I I definitely just feel like if you're out there, like, I think the thing that is so rewarding about doing this work it's hard work. I mean, I could
Mhm.
all sorts of different ways, like, you really have to hold a container and a space for people during, like, the darkest night of their life, and
Mhm.
it is so rewarding when you get on that, like, precipice and the lights at the
Mhm.
end of the tunnel and people start to get their life back because we both have had our own journeys, right? And when you
Yeah,
don't
we didn't
have,
we didn't get to talk about your journey too.
yeah. Oh, yeah. Yeah. I mean, I think it's just like, what keeps me passionate about this is that, when you're vulnerable and you don't know where to go, like, like there can be like a lot of influences that kind of
Mhm.
feed your brain. Like you have a choice, right? You can either, thrive and get through this experience with, healing and transformation, or you can go into victim consciousness and
Mhm.
fear and, not feeling like you're ever gonna get better, and so, yeah, I just, wanna hold that space for people that I'm
Mhm.
never gonna limit what's possible for people, and I understand it's a lot of, a lot of effort and energy and resources on their end, but we just have to keep helping people and shifting the paradigm so that
Mhm.
this becomes more commonplace.
Mhm. Mhm.
Yeah.
Yeah, and I really do see you do that, just whatever it takes kind of
Yeah.
to help your patients. So I really appreciate that. But I do know that you had your own major journey,
Yes.
so I don't know if you want to quickly share
Yeah,
that.
yeah, I'm happy to share that. I feel like I'm coming out of like, life is always going to present us with stuff. This idea that we live in utopia and that everything's going to be fine is not the life I've lived, at least. But
Mhm.
and we can choose how we move through certain situations. And I guess, kind of the cliff notes is like I've always been interested in like the biophysics and the energetic
Mhm.
part of medicine. And I, was going through already like a tough time during COVID. My mentor sued me. I had like,
Mhm.
I created like my baby, this practice for 10 years. And I was like, oh my gosh, having to start it over in the midst of
Mhm.
all of this, being like a new mom and all of these things.
Mhm.
It's like life was intense, right? I lived in Seattle where COVID was really intense. And so I was already finding the work of Joe Dispenza and meditation. And I was really interested in like just like the invisible fields and forces that, can support us and also make us who we are. And so I chalked a lot of my symptoms at that time to
Mhm.
because I had
Mhm.
things. I'm like, I'm just stressed. I just need to
Mhm.
like get through this time and then, go on a retreat and I'm going to feel better. And then,
Mhm.
my husband and we wanted a second child. And, he's like, Christine, we're not getting any younger. Why don't we just go kind of like get checked out? And so this doctor kind of did what I would have done for another patient, but it's always, hard to be the patient when you're in the seat. And I had an MRI. I dragged my feet because I was in the middle of a lawsuit, but I finally got the MRI. And, like I had a moment when I came out of the MRI, like time stopped. Like I just had this sense like something was, important that I, was about to
Mhm.
embark on. And the next day, I had the MRI read by the doctor, and I had a pretty large pituitary macroadenoma. It was 3.2 centimeters. It was also
Wow.
secreting hormones that were affecting, my physiology. And, I didn't know because I had it on both sides. It was affecting where the pituitary is. It affects the optic chiasm. And I had bilateral field deficits and I didn't know it because they were on the same, my eyes
Wow.
on the same. I knew my night vision was going. And again, you just chalk all this stuff up to stress. And
Mhm.
so in 2 short weeks, I was shuttled into getting brain surgery. And, as somebody who like helps people detoxify and heal their brain, it was like very jarring. And
Mhm.
top of like, could life give me more? But,
Mhm.
I had my like dark moment that we all have to like feel. And I just really leaned into like the principles and the things that I was learning about. And I just really like in 2 weeks, I worked with energy healers. I did coherence healings. I had great friends who circled around me and did intention circles. I did a lot of meditation and visualization. And I turned that kind of story that, like, okay, instead of being like another thing. And again, you have to feel your feelings, but like I have an opportunity to see what I'm capable of. And so
Mhm.
I went through the surgery. They go through your nose. They don't open your, brain. So I had a great surgeon. They
Mhm.
go through your nose. And then Joe Dispenza always says, which inspires me a lot, when you change matter with matter, it takes time. But when you change the field, you change matter. And so I had that validation when I went to the follow up about a month later and I had donated my tumor. And I, basically said, he was running like 2 hours late. And at the end of the appointment, I just said, oh, what is the pathology report? Anything to know? And I was healing well. And he's like, well, I'm going to be studying your tumor for a long time because most of all, I want to understand, like, it had all these different cell types. It was really unique. And most of all, I wanted to understand, for a tumor that size and that large, and he does like 420 of these surgeries a year, why yours came out so easily. And so that was like a little bit of my validation. Like,
Mhm.
we might not have the understanding. There's a lot of, mysticism in life that we don't always understand why we're going through certain things,
Mhm.
but we can, choose how we move through them.
Mhm.
That was like a huge experience. And I've continued to be humbled by other experiences in life that, again, draw me to like, these realms and
Mhm.
to learning, like what is possible for people. And
Mhm.
that's really what I try to share with patients too, like,
Mhm.
be that cheerleader and give them
Mhm.
that opening of hope
Mhm.
again. And
Mhm.
hope is such a powerful force for humans. When we don't have hope, we just want to die and we don't want to live. But when we have hope, we can really accomplish, anything. And so,
Mhm.
yeah, I that was definitely a life-changing moment in my life.
Yeah, thanks for sharing that. That's a
Of
beautiful
course.
and powerful story
Yeah.
and inspires people like you do in many ways. I don't give people compliments very easily. So just pouring them onto you. But yeah, I've seen it firsthand and I don't I think a lot of people in the industry these days are maybe not as well intentioned. So yeah, we appreciate you. Thanks so
Oh,
much
thank you.
for your time and
Oh,
I'm glad we finally were able to do this.
oh,
And
divine
we're
timing.
all like here to we did
Yeah,
it.
divine timing for sure. No, and thank you
Yeah,
for all the work you're doing. It's incredible what you're doing as, recovering yourself and yeah, and you're teaching and
yeah,
sharing so much, to others.
yeah.
So it's
Well,
awesome.
thank you for helping me too.
Yeah, of
So,
course.
I'm sure there'll be a part 2 for sure, but
Yes.
again, find Dr. Christine, join her sensitive stack, see her as a patient. She's amazing. Anything else?
No, just, we're here for you and we're
Mhm.
just I think in my lifetime I'm just really committed, like how can we make this path more elegant and more, like
Yeah,
empowering and transformative for you, and that's what keeps me going.
yeah.
So,
Thank you so much.
yeah, thank you, Steph.
Bye.